K102.5 FM.
From Feature Story News, I'm Natalie Powell with your latest world news. Spain's central government continues to squash separatist sentiment in the Catalan region, which held an illegal independence referendum earlier this month, though Catalan authorities say they will not follow the government's orders. Japan's Prime Minister has promised strong countermeasures against North Korea, and the US-led coalition in Syria has been accused of leaving the city of Raqqa in ruins.
It's 9:01.
Community Conversations is brought to you by Arkansas Early Learning, offering no-cost childcare in Jonesboro and Northeast Arkansas. Applications at arearlylearning.org.
Arkansas Early Learning is a nonprofit organization.
KLEK LP Jonesboro, the voice of Arkansas Minority Advocacy Council. It's now time for Community Conversations, a program focusing on the people working to make the Jonesboro community a better place, while offering viewpoints from all sides of the issues. The views expressed in this program are those of the participants and do not necessarily reflect the views of KLEK 102.5 FM, the voice of Arkansas Minority Advocacy Council, or our underwriters or sponsors.
Good morning, everyone out there. Happy Monday to you. You are tuned in to Community Conversations on KLEK 102.5 FM. I'm your host for today, Quabila Harden. I have a room full of very special guests with me today, so I hope that you all are ready for our topic of the day. Today we're going to be talking about breast cancer. I have two survivors with me. I also have a professor from Arkansas State University from the nursing department who's going to give us some background information on this disease. I'm not going to do a lot of talking. I'm going to let everyone else have the floor, but I would love each individual to introduce themselves. I have Mrs. Kara Maxwell, Mrs. Kathy Hall, and Mrs. Sandra Combs. So I really thank you all for joining me today, and I hope that everyone, if you have any questions or comments, you can give us a call, 870-277-1080, or you can watch us live on Facebook and drop us a message or word of encouragement or something of that nature. So I'm going to let everyone start introducing themselves and give whatever information they would like to, and then we'll get into our topic. So, Ms. Kara.
Hi, everyone. I'm Kara Maxwell. I was diagnosed in March 2016, and I'm just here to give you guys a bit of my story.
Alrighty, thank you.
Hi, I'm Kathy Hall. I'm an associate professor of nursing at Arkansas State University, and I've been an oncology certified nurse for a long time.
All right.
I'm Sandra Combs, and I am a breast cancer survivor and thriver, which word I started to use. I was diagnosed 3 months to the day that I came to Jonesboro, Arkansas, in November 14th, 2008. And as of now, I am on no meds and, thank God, cancer-free.
Amen. Awesome. So, Kara, we just kind of go around the table. Can you tell us a little bit more about your diagnosis and a little more background of your story, and then we'll get into some deeper details. But
okay. Well, I was diagnosed. I had found the lump back in January of 2016, and I thought, well, maybe, I'm just getting a little bit older because I just turned 30. And I know it sounds crazy, but I was like, oh, everything's just going to change. And then it started getting bigger and sore and redder. And that's whenever I was like, oh, well, maybe I need to make an appointment. And that's whenever everything went haywire. Like within 3 weeks, I was diagnosed with stage 2A breast cancer. And I've done chemo, radiation, lumpectomy, and a double mastectomy.
Wow. You have gone through quite a bit in just a very short time.
Oh, yeah.
And so when we, get deeper into the conversation, I would love for you to share what it has been like on your family, because you have children and a husband. And, that some people don't realize that plays a role. It takes a toll on them as well. They're going through it as well as you are going through it.
Oh, yeah. It does.
Okay.
It does. I have all three of my children, I have enrolled in therapy because they showed signs that it stressed them out in certain ways or another, and I felt like it was better to handle the situation head on than to wait until later and have them regret it or say, well, maybe you didn't do this or maybe you didn't do that. And I wanted them to know that everything is going to be okay.
And that's awesome. Hopefully, other people that are listening that do have small children will take that into consideration, getting them some help early on in the process versus years down the line.
Oh yeah, because I thought that with my youngest child at 3 at the time, I didn't think that it would affect her in any kind of way, and it's probably hit her the hardest out of the 9-year-old and the 15-year-old.
Really?
Yes.
What were some things that she expressed?
She regressed. She went back in potty training, her speech and her behavior. Everything just kind of went downhill. And I noticed some things like that those weren't right, and I knew that that wasn't right. So that's whenever I talked to her doctor, her pediatrician, and I suggested the therapy. And her school went along with it, and they were thinking, you know, that's great. They invited them in with them, and they worked with us, and they were great about it.
That is really awesome. So, since March, how are they doing now?
Oh, we talk about it. I don't hide anything from them. I speak to them on an age-appropriate level, and I give them as many details as they ask about.
Okay.
Just because the 15-year-old would like to know more than the 5-year-old. Because the 3-year-old is now 5. And then the 9-year-old, she doesn't need to know as much as the 15-year-old, but she wants to know some detail. And I fill them in. I don't let them miss out on anything.
Oh, that is really awesome. Thank you. And we'll get some more of how things have been for you since your diagnosis. Okay. Miss Kathy, can you tell us, we hear breast cancer, so we think it's just, okay, a lump in your breast, and you go maybe have surgery, you have chemo and other treatments, but tell us what exactly breast cancer is.
Well, breast cancer is when the normal regulatory mechanisms of your cells don't work, and so you have cells that get out of control and grow and can form a tumor.
Okay.
And that's pretty much what happens with any kind of cancer.
Okay. So let's talk about how it's detected. What are some of the various ways that it's detected?
Okay. Well, there's usually a 3-pronged approach to detecting breast cancer, but it's not uncommon for a woman to find the mass herself.
Okay.
Like you did. And so breast self-exam is one of those techniques that we use. Another is mammography.
Okay.
And the other is a clinical breast exam by your primary health care provider.
Okay. Now, I have seen in some reports that some people go as far as having ultrasounds done. What would be the reason to go that far?
Ultrasounds are done usually in women with firmer, denser breasts. As we age, think about your grandmother. What happens to our breasts as we age.
Yeah.
They're less firm, they are less dense, and they're composed of more fat. The whole composition of the breast changes as we age.
Okay.
One of the things of aging, no one wants to get older, but let me tell you, it just happens. And so with younger women with denser breasts, sometimes an ultrasound might be done. Oftentimes even an MRI or a magnetic resonance imaging might be done too. And that's shown a lot of promise with screening. It's even being used as a screener sometimes.
Okay. Alrighty. And then, there was this old adage that women over 40, it's something about hitting the age of 40 that things start happening. You need to start getting all these various tests, but more and more reports are coming out that women, even in their 20s, are getting breast cancer. So, would you say those numbers change?
Well, health insurance pays for screening based on the number of people it can help.
Okay.
It boils down to money and who's paying, because nothing's free. And the incidence or the rate of breast cancer really rises sharply when we turn 40.
Okay.
So if we started screening people at 20, there wouldn't be enough money to screen people at 40. I always tell that to my students because it's just like, well, why don't we screen people? Really, it's rare to have breast cancer in the 20s and 30s. It's unusual. but sometimes when we see it in younger women, it is a more aggressive kind of cancer.
Okay.
But 40 is really when the rates of breast cancer rise sharply. So age is definitely one of the risk factors, and that's something we can't fix.
All right. So do you suggest that women once they hit puberty, up to 30, whatever, they need to be more proactive at doing home exam?
Yes.
Okay. And then let's talk about the comparison of getting breast cancer among different ethnic groups. We've heard that with African American women or women of color, ethnicities, it's more aggressive. It tends to be more aggressive.
Well, without a doubt, we know that African American women are diagnosed at a more advanced stage of disease.
Okay.
We've known that for a long time. Some reasons we're not real sure. Part of it is access to screening and health care. There also may be a biologic reason or some biologic factors that come into play. And that we're still looking at. There's so much research going on now. The Susan G. Komen Foundation has spent $33 million on early detection of breast cancer.
Oh, wow.
That's a lot.
Yes, it is. And I'm praying that within our lifetime we see a cure or at least some major advances.
That's what the Komen Foundation is shooting for. And good numbers, as far as reducing the death rate of breast cancer, since 2002, since the late 80s and 2002, the death rate has fallen almost 40%.
That's amazing.
So it increased consistently since the 70s, wasn't it?
So it's getting better and better with early detection. So we've got our work cut out for us, doing a lot of education.
Okay. And then another misconception, and I think more reports are starting to come out, that men also get breast cancer. So have you encountered, and I know Ms. Kira is going to actually share some information with us. She had the opportunity to interview a male that has gone through breast cancer treatment. So I'm very anxious to hear that information. But when would you say some of the first numbers started coming out, or how is it even detected in men?
Men don't get screening mammograms, and men usually don't do breast self-exam. It's not that common in men. 99 out of 100 cases of breast cancer happen in women.
Okay.
So 1 out of 100 is a man.
Oh my.
But there seems to be a link with prostate cancer and male breast cancer. So if a man has had breast cancer with other men in his family, he does need to be watched more carefully. Okay.
All right. So I just want to encourage everyone out there to be more proactive about your health. Get those screenings on a regular basis so that you can stay on top of what's going on with your body. Right. So we're going to bring Miss Sandra in. I want you to please give us a little background of your diagnosis and what life has been like up to this point.
First, I'd like to say that Kathy was one of my nurses. After I would have chemo every other week, I would have to have a very expensive $600 shot. And she doesn't remember it, but her dean encouraged her and some other nursing faculty to come to my home every other Saturday and give me my shot. And Kathy was one of the ones who came. Well, I started getting mammograms when I was 40 because I'd had fibroid tumors earlier in my life. And so for 12 years, I'd gotten mammograms. Nothing happened. I have lumpy, dense breasts. So when I moved here and had to get mammogram scheduled, went to the imaging center, and I wasn't really concerned that they called me back because I have lumpy breasts, and it was the first time that they'd read my scans, and so they called me back, and then they said, well, we think you need to see a surgeon. I'm going, oh no, this is serious. No. The unfortunate thing for me was that I was here alone. But what I soon realized that I wasn't alone, because the women from the breast cancer support group that I'm a part of, and my ASU family, which was very new, came to my rescue. You know, I had women from the support group who would take me to chemo, you know, and take me to lunch afterwards. And I, like I said, had nurses from A-State come and give me my shots. $600 for one shot, I'm telling you. And I can't imagine how much it costs now. But the thing about it is, so mine was detected through a routine mammogram, which I thought was routine. And I'd been getting mammograms for, like I said, for 12 years.
12 years. Oh my.
Yeah.
Okay, and so you never tell us where you're from originally.
Oh, well, I'm originally from Orlando, Florida. Okay. I spent 30 years before I moved to Michigan. I mean, before I moved to Arkansas in Michigan.
Okay.
And I've been here since 2008.
And when you got your diagnosis, did you have any family members or children or anyone to reach out to?
When I got my diagnosis, I was hiding it from my family.
Okay.
Because I just moved here, and you know, I left friends and family in Michigan that I'd been with, and regular doctors who I knew. You know, I had my regular doctors on speed dial in Michigan.
Okay.
I didn't have any doctors here. I had to get a primary care doctor. I had to get a surgeon. I had to get an oncologist. And you know, it's like, who are these people? You know, they don't know me. But anyway, it was very helpful with having a nursing school and getting recommendations from support group members. And I did talk to a friend of mine in Michigan who had been diagnosed with breast cancer like 5 years earlier. And, you know, I was there with her and, you know, supportive and everything. And so I call her up and I say, you know, what do I do? And she sent me this book, Breast Love. I think that's, I forget the name of it. But anyway.
Dr. Susan Love's breast book.
Breast book, right, right.
One of those in our bank.
Yeah, so I got that, and you know, she would walk me through stuff. For instance, and my sisters, for instance, in doing chemo, and I don't know whether you had this kind of problem. The taste of food. Mm-hmm. So I was told to eat with plastic. So now when I talk to people who are going through chemo, I said, get rid of the silverware because it's going to make the food taste funny.
Dish soap.
Right.
Oh my
You know,
goodness.
and deodorant, you change the deodorant and all that stuff. But yeah, just something simple as eating with plastic. You know, eating with plastic. You have to drink a lot of water and but anyway, so that's what I found. I found a family at A-State, and at the time, our he was President Potts. His wife had been diagnosed after they moved here, and somehow he found out that I was diagnosed, and then he introduced me to his wife, and then sent an email to Dr. Susan Hanrahan about getting me some nursing help, and that's how I met Kathy.
That is absolutely amazing. Thank you so much for sharing. And people don't realize what you all go through. Just your life literally changes in an instant once you get the diagnosis. What are some of your, and I would like both of you, what are some of your initial thoughts when you're sitting in the doctor's office and they say, they have your little file and they're like, okay, the test results show whatever, however they, present it to you.
I got mine in a phone call.
I had mine in a phone call. And
I thought that was awful.
And I thought that, I've never met anybody with breast cancer, never known anybody.
It's not in my family.
History.
Right.
All my genetic testing come back negative. And I was 31, so I'd never met anybody with breast cancer before. I didn't even know anybody in their 30s could get breast cancer. Not in a million years. And so I automatically knew, I thought that it was a death sentence. That's what I thought. That was my first initial thought, like, oh my gosh, I'm gonna die.
Oh no.
It's really, I distinctly remember when I got the phone call. I was on my way to class. Had my cell phone on my way to class, and they called and said, the lump we found is cancer, and you're gonna have to have chemo and radiation, and you need to talk to this person and that person, and I'm going, okay.
You can't even process it because
Right.
It's like you get this big news and they tell you all this information and all these dates and all these doctors, and you can't even process writing it down.
Right. I couldn't write it down. Anyway, I'm literally on my way, got my stuff in my arms, on my way to go teach my class. And so on the way down there, I was on the 3rd floor, going to the 2nd floor, I stopped by my chairman's, my boss's office, and I said, I just got this call, I have breast cancer, but I'm gonna go teach my class, and I'll probably go home after that. And he go, oh yeah, sure, he's probably freaking out more than I was. So I went and taught my class, and I went back to my office, got my stuff, went to my house, got in the middle of my bed and cried.
Okay, so we're going to have to pause right there. We're getting ready for a break. When we come back, we're going to hear more stories. So we're also going to hear some information from an interview Kira did with a man to share his experience. So please stay tuned, and we'll be right back after these announcements.
You're listening to Community Conversations on KLEK 102.5 FM. We'll be right back.
Do you flirt with your spouse? I'm Mark Merrill with today's Family Minute. Flirting with your spouse is a good thing and can reap a lot of benefits. So here's some fun, playful, creative ways to flirt with your spouse. Leave a note for her on her pillow or mirror before you go on a trip. Something specific like, thanks for taking care of so many details when I'm gone. You do a great job. Or leave a note on his car rearview mirror saying, I'm jealous of this mirror because it's looking at you. Maybe turn on your favorite song on your smartphone and dance in the kitchen with her when she least expects it. Not every idea works for every spouse, so try different things. For more ways to flirt with your spouse, visit my blog at markmerrill.com. Remember, your family first.
Family Minute is made possible by the Kappa Nu Omega chapter of Alpha Kappa Alpha Sorority Incorporated, a non-profit organization committed to service to all mankind. Kappa Nu Omega Alpha Kappa Alpha on Facebook and KNOMEGA1908.com.
KLEK thanks CJ Pepper and the staff of Life Strategies Counseling Incorporated for helping people through hard times in life such as depression, family issues, stress, abuse, and more. They offer counseling and therapy for all ages, individuals, families, and groups. They are located at 1217 Stone Street. Phone number 1-866-972-1268 or online at lscihelp.com. Meineke of Jonesboro is now Starks Auto Service, a full-service auto repair and vehicle maintenance center, offering engine and transmission repair, brake service, tires, oil changes, and more, performed by ASE certified mechanics. The all-new Starks Auto Service, 2813 South Caraway Road in Jonesboro, 870-204-7112. Starks Auto Service, Jonesboro.com.
The McDaniel Law Firm, 400 South Main Street in Jonesboro, is a firm believer in justice and equality for the minority community. The McDaniel Law Firm has fought for our rights for over 44 years. The McDaniel Law Firm offers legal help for wrongful death as well as trucking and automobile accidents. Bobby and Brett McDaniel are available for a free consultation at 870-336-4747 or at www.mcdaniellawyers.com.
Trunk or Treat 2, A community event bringing children and law enforcement together will take place Thursday, October 26th from 5 o'clock p.m. until 7 o'clock p.m. on the 700 block of Melrose and Marshall in Jonesboro. There will be a bounce house slide provided by Spacewalk of Jonesboro. Diego Ranch will also be there. Music provided by KLEK 102.5 FM, as well as law enforcement agencies from all over the region and other community groups and organizations providing candy and food for children. Donations of candy are also needed. Donations of candy can be dropped off at the Jonesboro Police Department and given to Sergeant Cassie Brandon, or may be brought to the event. From the KLEK Community Calendar, Christ Ambassadors Ministries International presents Spiritual Preparation Conference, November 9th and 10th, 2017, at the church located at 5114 East Nelton Avenue in Jonesboro. The conference will be hosted by Bishop Ani and Pastor Gwen Jacob. Special guest speakers will be Tommy Smith ministering in worship, Apostle Brian Carter, and Bishop Adrian Rogers of Fullness of Joy Ministries, who will be the special speaker for Thursday night. The start time for each night is 7 o'clock p.m. More information is available at 870-623-4013.
And now back to Community Conversations on KLEK 102.5 FM.
All right, welcome back to Community Conversations on KLEK 102.5 FM. We're speaking with Mrs. Kara Maxwell, Mrs. Kathy Hall, and Ms. Sandra Combs from Arkansas. Ms. Sandra and Kathy from Arkansas State University. Ms. Sandra and Kara are breast cancer survivors, and we really thank them for being here, sharing their stories, and being so open and candid. I really pray that everyone out there listening is taking something away from this, because it still takes, even though you are a survivor after so many years, it still takes something out of you to come and talk about it. Sometimes you just don't want to talk about it all the time, but talking about it helps other people as well. So I'm very thankful and grateful for you all coming and sharing your stories. We do have a Facebook comment, a shout out. I want to say thank you to Christy Mathis Conaway for checking in, and then from Benita Hill, she says check more and fear less. So thank you so much for that, Miss Benita. Okay, so we're going to get into the notes that Kara has from the man that she was able to speak with. So tell us, how did you come in contact with him? Is he part of the support group you're in?
Oh, no. He's actually a friend, one of my good friend's fathers.
Okay.
He was diagnosed in January 2009. He doesn't remember the exact date. He's lost a lot of his memory. So, like, a lot of his memories are kind of there, but not there all the way. Okay. He remembers bits and pieces of it, but he knows that it was a stage 2 invasive ductal carcinoma. He had a hormonal positive and HER2 negative stages, and he had to do 8 months of chemo every 3 weeks for 8 months.
Every 3 weeks for 8 months?
Yes.
Was it once a week for 3 weeks, or every day 3 weeks?
It's once every 3 weeks.
Okay.
For 8 months.
Oh wow. Okay. Now, how was his detected?
He says that it's crazy because he was working on his car in his shop one day, and he had previously noticed that his nipple had inverted, and then he bumped it on a car piece, a bumper. And he was like, ouch, that really hurt. It hurt really bad. And it hurt bad enough for him to go and say something to his wife about.
Wow.
And that's whenever they got together and they decided that they would make a doctor's appointment. And a few days later, he was diagnosed with breast cancer.
Oh, wow. Okay. Well, I really thank him for sharing that. So now, how far along is he?
In his treatment?
Yes.
He's been doing hormonal medicines for the past 7 years. He has 3 more years left because it's a 10-year treatment for the hormonal positive part of it. He says that he's now disabled because his memory and going through chemo, and he's got some side effects from that. But he's also a Navy vet, and he was in Vietnam. And I asked him, I said, so do you know how, or do you blame any part of breast cancer on anything? And he told me that he had other people who were diagnosed with breast cancer who were involved with Agent Orange. And now they are also on the process of putting breast cancer as part of one of the side effects of Agent Orange on the list.
Oh, wow. So, unfortunately, he had to experience this, but it has now raised awareness for another issue that may have gone overlooked if it had not been for him and others that are experiencing these side effects of that Agent Orange.
Very true.
All right, so has he had to have any surgeries as far as removing tissue removal?
Yes, I asked him about that, and he had to have a lumpectomy, which is a partial mastectomy. And I asked him, I said, so were you going to have reconstruction? And he says, no, I just tell people I got a gator bite.
Oh, my goodness. Oh, my goodness. Well, I'm glad that he's in good spirits about it as well. Oh, my goodness.
Yeah, I also asked him, I was like, so how did you do it? You know, did you have support? He's like, no, I did it alone because nobody's aware that men can have breast cancer. Nobody's heard of it. And he's very active in the Susan G. Komen Foundation, and he's also does a lot of the races. And he's like, I keep all my awards and trophies because they mean something to me more than what a lot of people think.
That's amazing. And I hope that through his experience, his journey, that he can reach other men and encourage them to test themselves or pay attention to their body, and take care of themselves, and do what needs to be done so they can live a long, healthy life.
For the future, he said that he wishes more men would feel themselves.
Oh, good.
He's like, just feel your chest. He goes, you'll know when something's not right.
Okay. There's a lot of memes out there that talk about that. Oh my goodness. We have another Facebook shout out from Miss Donna Kursky. She says, yay, Sam. So I'm guessing
that's me.
Okay.
She was one of the breast cancer support group sisters who also worked at Arkansas State University during my time when I was going through. Yeah, thanks, Don.
That's wonderful. I can't even fathom trying to go through this alone. Like you all both stated, when you got the phone call, were both of you were by yourself when you went to class? Mm-hmm. Were you by yourself?
I was at home with my 3 kids while my husband was at work.
Okay, and so
I called him. And I was like, and I just bust out crying, and I told him what happened. And he's like, I'm on my way home. And he's been here ever since. He's been on my rock.
Well, let's talk about that. I wish, if he's not too shy, do you think we can get him on the mic?
Why you want to come talk?
So we're going to hear actually from Kara's husband, what this journey has been like for him. People often overlook the caregiver, whether it's a spouse, a friend, whatever role they play in your life. People often overlook them. So thank you for joining us, Jamar. Can you tell us what your experience has been like through this process?
Well, it's been a learning experience.
Okay.
A lot of stress.
A lot of stress.
Yeah, but you find ways to hide it, find other ways to deal with it.
Okay.
Because you have to.
Because you and Kara have been together for a while. I've been knowing you all, oh my God, umpteen number of years. And you all have had a very strong, loving relationship. And so when she first told you about the diagnosis, what went through your mind?
Well, honestly, I was just kind of, blank. I just kind of went blank. I didn't know what to do. Because any decision that was made was going to be really her decision. So
okay.
Only thing I could do was, support her, stand beside her.
And when you did get home and you all were able to sit down with the children, how did you all present it to the children?
She just kind of came out and told them.
I just told them what I knew, and they were like, it's going to be okay. And I'm like, yeah, I know it's going to be okay. They were a lot stronger than me at that point. Okay. They had more hope than I did.
I can imagine. I've seen, videos and pictures, and I've read stories of the sleepless nights, the upset stomach, and the other darker side of going through treatment. For you, having to watch her go through this, not knowing exactly what she's feeling, how did that make you feel?
I hated it. I mean, honestly, I wish I could have took it for her. So, I mean, nobody wants to see somebody that they love go through something like that.
Amazing. And for you, Kara, what was it like? And you also, Miss Sandra, tell us some of the darker side of going through treatments. People think, okay, you go, you get chemo. Yes, you feel weaker. Yes, you may have an upset stomach here or there. But what are some of the real dark sides of
hair loss?
Actually, the hair wasn't the thing that I dreaded. I felt free. Like whenever my hair started coming out, it came out. Like everybody who knows me knows that I had an immense amount of hair.
Yeah.
And so like I filled up a Walmart bag full of hair, and so I started crying that night. And my husband's like, "It's okay, I'll just make the appointment." And I went to the barbershop, and he's like, and I told him I need my hair cut off, and he cuts it with big guards, and I'm like, no, a lot shorter. And he's like, and he goes down to the next level, and I'm like, you gotta go shorter than that. And he asked me, he goes, why are you cutting your hair off? And I started telling him what happened, and everybody in the barbershop is silent, and they're crying, and I'm looking around like, okay, oh my goodness, I feel free, and everybody's crying.
Well, I cried. I was warned by my friend in Michigan that right after I started taking chemo that I should get my hair cut. I didn't have very long hair. It was down to maybe my shoulders, but it was very thick and very coarse. I started chemo about 4 weeks before Christmas, and I was going to visit a friend in Birmingham. So she set up an appointment at a barbershop there, so I wouldn't have to go around here. Barbershop there to get my hair cut. So my hair had started coming out because the red devil would get you. And so when I got there for Christmas, had this appointment, and I've worn my hair very short for years and years. But the thought of us getting in the car and going to the barbershop, I broke down and cried. I used to have every other week appointment at a barbershop, So what we wind up doing is drinking mojitos, and she cut my hair in her kitchen. But when I got back to Jonesboro, I went to my hairdresser and had her shave my head. And a girlfriend sent me a wig, and I got a wig from Hope Circle. But what I didn't realize about the hair is that you lose hair everywhere.
Oh yeah.
To this day, I still don't have underarm hair, which I love.
I barely have any. Like I'm
on
missing
my
eyebrows and my eyelashes. That's what I'm missing.
I have to draw my stuff in.
Me too.
And the other thing too,
become an artist.
Nose hair.
Yes.
Which is very important, as a nurse would tell you, to protect
constantly.
To protect you from infection and stuff. That's what the hair is in there for. You lose your nose hair. I didn't have ear hair, so that was okay. But the hair thing was probably the most traumatic for me. I borrowed a friend's blonde wig, curly blonde wig. We were having a family reunion that summer. I borrowed, and my hair wasn't coming back yet. And I said, so should I come to the family reunion with the blonde wig or without? And at that time, they said, oh, please don't come with the blonde wig. And I didn't. But for me, the hair was. And that because my friends had told me what to eat before chemo, not to lay down after chemo, walk and whatever, I didn't lose any weight.
Oh no.
I never threw up. I fainted twice after getting my Neulasta shot, but I didn't lose any weight. So that was the one downside for me, not losing any weight, but also losing my hair.
I had a different type of chemo than you did. I I had the
You didn't have the Red
TCHP.
Devil?
No, my friend, the guy that I interviewed had the Red Devil. He had the AC treatment, but I had the TCHP, and it was awful. I tried the walk, and it was like the world was spinning around me.
Yeah. I never, after each treatment, I would eat oatmeal before, and I'd drink constantly, because I had mine at St. Bernard's, I think it was. But anyway, I would drink constantly, and afterwards, whoever took me to chemo would take me out to lunch, and we'd walk around, so the stuff could like flush out, and I'd drink a whole bunch of tea or whatever.
Oh, wow.
But I never.
My chemos lasted for like 6.5 hours, so I was there in the morning. 6.5 hours. So I was there from the time they would open to the time that they closed.
Yeah.
And so by the time I would get out of there, it was almost dark, and then everybody would be getting ready for bed, and I'd be thinking, thank goodness, but it was you could be so tired and exhausted, but couldn't even sleep.
I had the last 3-4 chemo treatments were 3.5-4 hours. I never had 1 6 hours.
Oh.
But you're sitting there seeing that poison go in your body, which
and you can taste
basically
it.
it is. Yeah, and which is another reason why you eat with plastic after you eat your when you eat your food. So do you want to tell the audience about your pump that's going off that they might be hearing?
Yes. Okay. You guys might be hearing the ticking or clicking noise, but I have a wound vac because I had a double mastectomy, and because of that, previously before that, I had radiation, and with radiation, it breaks down the skin, and it doesn't like to heal. And I had a wound come open, and now I have a wound vac to help heal it from the inside out. So that's what the clicking and ticking noise is, if you're hearing that.
And so that's just another one of those darker sides, those unpleasant side effects of having breast cancer and having to go through the different treatments that you go through. I did want to ask Ms. Kathy another question I forgot to ask earlier. Is there a link between breast cancer and, say, hormones? Since women, of course, have an overproduction of estrogen at times, is there a link between the hormone production and breast cancer? And what are some of the risk factors?
Okay, first let's address the hormone question. Yes, there is a link. As far as starting menstrual periods early and going through menopause late, those are risk factors. Also, taking birth control pills slightly increases the risk, but after you've been off of birth control several years, that risk drops out of the way. But it's usually not a big issue because usually young women are the ones taking oral contraceptives, and they're at a much lower risk of breast cancer anyway. But we know that some breast cancers are sensitive to hormonal therapy, and that's a good thing. When someone has a biopsy done or they have a breast tissue removed, that tissue studied to determine if it's estrogen positive or progesterone positive. And that's a good thing when they're positive, because that's another kind of ace in the hand of the oncologist treating, because you can manipulate the hormonal environment and create a very unfavorable environment for the cancer to grow. Kind of like growing a desert in the rose. You can do it, but you've got to have fertilizer and water. And so if you deprive a hormone-sensitive breast cancer of its fuel, then it doesn't grow as well. And then we know with postmenopausal breast cancer, taking hormone-blocking drugs like tamoxifen, Femara, there are lots of different drugs, aromatase inhibitors, that work in the same way.
So do women that are pre- and postmenopausal experience different effects of breast cancer?
Well, usually when younger women, in their 20s or 30s have breast cancer, it's typically a more aggressive breast cancer than somebody who's postmenopausal. I've known women that have had metastatic breast cancer that's been in their spine, their ribs, their bone. Metastatic meaning it's gone from the breast to a distant location in the body, living years and years with metastatic disease.
Okay, thank you so much for that, Ms. Kathy. I want to ask Jamar another question. since you all do have a son, and what have your conversations been like? Has he come to you more so or more often than going to mom to talk about some of his feelings concerning her having breast cancer?
Well, I think he's actually talked more with her.
Oh, okay.
We keep an open relationship with the kids so that they come to either one of us.
Okay. And also, Jamar, you've been there for, of course, every procedure. What is it? Okay. I know with us women, we tend to get vain when it comes to our body parts. And if you don't feel comfortable answering this, just say, I prefer not. But watching your wife go through a double mastectomy, I know that doesn't make her who she is, but as her husband, how did you work through those emotions?
I saw it as, just a way to keep her here with us.
Okay. So, because I have seen stories where some men, they take a selfish approach. I have a selfish mindset about it. Like, they actually turn off, or their emotions, their feelings turn off for their spouse, which they try not to, but some part of them just, I don't know, shuts down. And so they see their spouse in a different light. So hopefully more men will realize it's for the better versus, just a matter of vanity. So we're going to have to stop again, take another quick break. When we come back, we're going to wrap up and let everyone share some final thoughts and any other inspirational messages they would like to share. Thank you so much for tuning in, but don't go away. We'll be right back after these announcements.
You're listening to Community Conversations on KLEK 102.5 FM. We'll be right back.
We're back with Money Matters. I'm Alfred Edmond Jr. The following pieces of money-saving advice are for those still in the planning stages for their wedding. Save on flowers by choosing whatever's in season for your wedding. Also, skip retail florists and shop with wholesalers or even farmers markets in your area and online. Save money by doing a breakfast or lunch reception instead of dinner, or offering a self-serve buffet instead of plated service. You can also save lots of money by limiting or eliminating alcohol at the reception. Finally, don't be afraid to delay the honeymoon until you can pay for it without putting additional financial strain on your new marriage. Check out costofwedding.com for more tools and information to help with budgeting for your wedding. And more important, you and your intended need to talk about how you will handle money before your wedding day and continue that conversation for as long as you're married. I'm Alfred Edmond Jr. for Money Matters, a product of American Urban Radio Networks.
Money Matters is made possible by the Jonesboro Alumni Chapter of Delta Sigma Theta Sorority Incorporated, a nonprofit organization dedicated to uncompromising commitment to communities, service, leadership, empowerment. www.jonesboroalumnidst.org.
Money Matters is brought to you by Bancorp South, offering checking, savings, loans, credit cards, and wealth management. 5 locations in Jonesboro to serve you. www.bancorpsouth.com or 870-972-9800.
Arkansas Early Learning prepares children up to 5 years old for kindergarten by offering a secure learning environment, qualified teachers at several locations in Northeast Arkansas at no cost. Applications are available at arearlylearning.org.
Arkansas Early Learning is a nonprofit organization.
The key to making this station even better could be parked in your driveway right now. Donate your old car to us, you'll get a tax deduction, and we'll tow it away for free.
Go to klekfm.org for more information.
And now back to Community Conversations on KLEK 102.5 FM.
All right, welcome back to Community Conversations on KLEK 102.5 FM. We're speaking with Mrs. Kara Maxwell, Mrs. Kathy Hall, and Ms. Sandra Combs, and we're talking about all things breast cancer. Of course, this is one of those topics you cannot fit in within an hour. We could talk about this all day long because there's so many ins and outs of this disease, but I'm really grateful for these ladies for coming to share the information that they have. Off air, we've been having a little bit of more lighthearted conversation. I'm trying not to make it too dark and heavy, but we just want you all to get a more realistic idea. It's more than just wearing pink and slapping on a ribbon and going to a walk. It's so much more that goes into having breast cancer or being related to someone, or having a friend, being close to someone that has breast cancer. There's so much more to it than just what you see on the outside. And so I'm going to allow these ladies to take the last moments to share some final thoughts, anything you would like people to know when it comes to testing, the process after the fact, you know, talking to your spouse or loved one. So we're just going to go around the table. Sorry, Miss Kara.
I would have to say, go with your first instinct. If you feel like something isn't right, chase it down until you're comfortable with the outcome. And always have somebody that's going to be there to support you, whether it's one person, two, or three. Just somebody that's going to listen and talk to you.
Okay. Thank you. Miss Kathy.
Well, I just wanted to say that only 5 to 10% of breast cancers are inherited. So a lot of times women have this false sense of security, and I don't want to scare people.
Okay.
But we think, oh, it doesn't happen in my family. Well, in 90 to 95% of us, it isn't in our families.
Oh, wow. That's all. I want to say, not scary, but it makes you think. Okay, so now we all need to be really proactive.
You need to be aware. You need to be aware of your normal breast tissue, what it's like. If you see something change, like a nipple that becomes inverted,
okay,
or a lump that you noticed that wasn't there before. And the Susan G. Komen Foundation has the best breast education materials.
Okay.
You can just type in Komen and it'll come up, Susan G. Komen Breast Cancer Foundation. They've got wonderful educational materials on there. They have they have 27 different languages that they publish information.
Oh, wow.
Yeah.
And also for the young women, they have the Young Women's Breast Cancer Coalition, and they give lots of statistics and facts and things that you can learn.
All right. And so just because you're not 40, that doesn't mean you can't start doing your research and finding out what's going on now. Okay. Mr. Jamar, for those, if there's any husbands or, loved ones, significant others of those that are going through, some advice, encouraging words.
Yeah, don't let it control your life. I mean, just like new diagnosis, if you got vacations planned for the summer or the holidays, don't let it stop you.
Okay.
I mean, shift the treatment around. Continue, move on. Enjoy your life.
Enjoy life.
Yeah, we
don't
know a
let
lot
it.
of that.
One thing Kara mentioned earlier, one of her first thoughts was it was a death sentence.
Yeah.
And it's not.
It's not.
It doesn't have to be, rather. So live your life and be happy. Ready? Miss Sandra?
Yeah, it is not a death sentence. And when I first heard it, I thought for sure it was. I'm going to die in a new place. I'd only been here like 3 months, like I said. So, but it's not. And the way I found that out is because I had people at A-State in the nursing department, Kathy, and others, and members of the support group circling around me, and my friends in Michigan who had gone through breast cancer treatment, so they kept me up to date on what I should do.
Alrighty. Now, since you all have reached this point in your life, have you found a new sense of self, maybe a purpose, or an awakening of some sort?
Oh yeah. You find the small things to be appreciative of. You don't look at all the negative.
I used to lie about my age. Now I don't lie about my age. I would be 62 on my birthday. Anybody who wants to celebrate with me can.
Right.
But before breast cancer, I was like 44 for about 10, 12 years.
Oh, okay.
Each day is a blessing, so I don't lie about my age anymore.
Alrighty. Miss Kathy, any words for people on the other side, like caregivers or friends, or what advice would you give for those that are trying to be a support?
Be patient. People may be moody when they're undergoing this experience, and it's not necessarily you. Just keep loving them. Just keep loving them. If you need to go in another room, if they're cranky, you need to go on a walk. Something. Just do what you need to do. Keep loving them. Don't give up.
Okay. Alrighty. So, Jamar and Kara, I saw that you all have taken some family pictures.
Yes.
So how was that experience? Taking pictures and
it was new
exposing.
for me, and it was hard for me to allow the world to see me in such a vulnerable state. It took a lot of reassurance from family to let the world see me in a different way.
Okay. Would you all, and this goes for Miss Sanders as well, will you all be getting any tattoos or anything to...
Oh, I can't wait. I haven't been released from the doctors yet, but I can't wait.
She's got a sketch pad at home.
All right, we have some more shout outs. I'm sorry. Go ahead and give your answer, Miss Sandra. Are you going to look into tattoos?
I would like one, but I've got some older relatives who, they're telling me I'm going to hell or whatever. If I get a tattoo, Leviticus, something they quote, in the Bible. But I would really like a butterfly on one of these port scars. So we'll see.
Alrighty. From Miss Gail Raspberry, she says, sorry, I joined late. And to answer your question, yes, we did talk about screening methods. Besides subjecting women's breasts to radiation. So I can't believe in this age of technology that a safer screening method has not been developed. Thank you for Keisha Higgins for checking in. She said, I'm loving this, proud of you ladies. And then Miss Donna says, this conversation has been so uplifting. Thank you so much for presenting this. Sam has been my rock.
I have to say hi to Miss Keisha because she helped me out whenever I found out that I had breast cancer, and she gave me a book to help describe it and help my younger children understand it.
Is the coolest mommy.
Yes.
Keisha Higgins is a local author who wrote a book about her journey with breast cancer and how she talked about it and how her family, kind of helped her through it. So I haven't had a chance to read the book, but I've heard wonderful things about her book. Keisha Higgins has also been very instrumental in this community to help raise awareness. So I would love to see more people stepping out. And I thank you ladies for stepping out and sharing your stories. And thank you, Jamar, for being our lone man on the panel, for sharing your experience with this. And I hope that you can reach other men and inspire them to be a stronger support system and really be that rock for their spouse or significant other. And thank you, Miss Kathy, for sharing your professional information. We pray that in our lifetimes we see some advancements in the research and treatments of this disease. So everyone out there, I don't know if I can say this without getting us kicked off air, but feel your boobs. Get up close and personal with yourself. So my patches listen, I'm sorry. We thank you everybody out there for tuning in, for listening and supporting KLEK. Don't forget, October is Breast Cancer Awareness Month, among other things. Get your checkups, and do your self-exams at home. Everyone
Thank you for listening to Community Conversations on KLEK 102.5 FM, a program focusing on the people working to make the Jonesboro community a better place while offering viewpoints from all sides of the issues. The views expressed in this program are those of the participants and do not necessarily reflect the views of KLEK